Our next speaker this evening is Dr. Reem Al Soufi. She was born to a Palestinian family in 1977, raised in Jordan, and came to the UK in 2003 to pursue postgraduate training and specialised in emergency medicine in the north of Scotland deanery. She is now a consultant in NHS Lothian and a postgraduate dean with NHS Education for Scotland. Reem founded GINA, Gaza Infant Nutritional Alliance, with a focus on breastfeeding support and early nutrition support. Reem will speak about health, trauma and healing within the Palestinian context. Thank you, Reem.
Good evening, and it's very nice to be back in Inverness. I spent my first year of training in Raigmore, and I recognise so many faces in the audience, so it's so good to be back. I'm feeling actually very emotional after all what I've heard, and so forgive me if my flow of thoughts is not as flowing as I wanted it to be. So I'm here to bring a personal story alongside something medicinal or related to medicine. So I am the first generation of Al Soufi family to be born outside Palestine. And my father, as a 5-year-old child, left the south of historical Palestine in 1948 and moved to Gaza. And he lived in a refugee camp until he was in his 20s and left to Saudi Arabia, Libya, Jordan. The story of the diaspora of Palestinian is very common, and probably Salim and other members in the audience might recognise this sparse existence. So I was born in Libya, grew up in Jordan, and came to the UK in 2003 and landed in Glasgow. I visited the Highlands and the Western Isles and went through the museums that told the story of the Highland clearance. I recognise the human suffering and I empathise. And I understand why there's so much empathy in Scotland. So thank you very much for this watchful recognition of human compassion and human right to exist. So, curled up on the sofa, crying my eyes out because I had an infant myself. I had a 1-year-old daughter when all of this started. And watching all the horrible things happening on my phone and on the screen, I couldn't only think of mothers like myself. We've got an infant to feed. It's so difficult to do it in peace. How can you do it? I still have uncles and cousins living in Gaza, and just contacting them and asking them, how do you feed your babies? And realising the challenge is quite early on, as early as October and November. And I went from one place to the other, asking, how can I get milk into Gaza? And it wasn't easy. I phoned all the big names, Save the Children, UNICEF. I emailed, I couldn't get anywhere until a Scottish charity called Scot Aid agreed to take milk, formula milk, into Gaza on my behalf. So I started a GoFundMe that several people in the audience have contributed to generously, so thank you very much. And we managed to raise £30,000 and get 12,000 cans of formula milk. But by that time, some of my colleagues who are paediatricians and had more experience than myself as a mere emergency medicine consultant said, Reem, are you sure you're doing the right thing? Infant and young children feeding in emergency, a new term, completely new term to me, is not done this way. Getting formula milk in a war zone where no clean water is feasible could harm the children. And this is when I started to learn about this. Maybe if we can turn the lights off, because this slide is very important. Thank you very much, Fatima. So the science says that the red big line is where infant mortality in children less than 6 months is due to them not having any breast milk. And the green tiny line that you might not see is infant mortality in the exclusively breastfed babies. And the bit in between is when they mix, whether it's predominantly formula milk or it's predominantly breast milk. Thank you. Can I have the light back, please? So breast milk is more than just a nutrition in a war zone. And this is what I didn't realise, but I quickly realised. And I started using skills that I learned in the NHS, the principles of quality improvement, all leadership skills, and moved to, okay, we need to do something about breastfeeding. How do we re-establish breastfeeding as the main modality for those infants? How do I encourage people? So through the crack door of WhatsApp and social media, tried to reach out to nurses and doctors and midwives and say, guys, out of all the interventions that we do, including getting clean water, sanitation and hygiene, which reduces mortality by 3%, breast milk drops the mortality by 13%. And the answer I get from the doctors and the nurses that I could get to speak to was that we did all of this. We did the skin-to-skin care, and we did the breastfeeding, we did all this promotion before the war. Now it's too busy in the war to do any of this. We evacuated Al-Aqsa Hospital, maternity hospital, to another private maternity hospital, because Al-Aqsa Hospital is now only for the injured and the burnt. So it was how do I walk that journey with them? How do I say we need to, because it's not a luxury, it's not something that can wait till the war is over. And with the help of other lactation consultants, with the help of the doctors and nurses I could get hold of in Gaza and in the UK, we established GINA, which is Gaza Infant Nutritional Alliance. We are an alliance of 7 women to start with. A Glaswegian peer supporter, previous police officer, her sister-in-law, neonatologist in Dundee, a lactation consultant in Birmingham, a lactation consultant in London, and we're all sharing the same passion that we want to help and we want to do it properly. We want to do the science bit. And since March, every day, I'm almost running a remote clinic, and at the same time managing a growing alliance of concerned individuals, mostly women, but we have men on our board as well. I'm going to tell you the story of Salma. Salma is a young mother. She's in her 20s. And this is Bayan, her daughter. Bayan is now 9 weeks old. We first got in touch with Salma when she was referred to us by the doctors because she thought that her baby was having diarrhea and she was having issues with her milk supply, and she was using a lot of formula milk. And she was so worried because the formula milk was scarce. She couldn't always boil the water, and she was in the Nusayrat camp when the horrible massacre happened, when the special forces descended on them, and she was on the phone to me saying that, pray for us, they're here, we might die, this might be my last message. And we walked the journey with Salma. We walked the journey of building her confidence, building her own breast milk supply. Today, Bayan had a visit to the doctor and she got weighed, and she is weighing 5.5 kilograms. She's on the 50th centile. She is exclusively breastfed. She's fit, she's healthy, she's not needing any extra medicine. And her mum is so proud of the journey that she's been through. This is actually a short way of summarising the achievement that Salma has really managed to get from mixed feeding, predominantly formula, to exclusively breastfeeding, and to being now a breastfeeding peer supporter that helps other mothers in Gaza. We have a referral system in Al-Aqsa Hospital, Al-Auda Hospital, and we have a special breastfeeding tent established in Mawasi area. A dedicated team in Gaza and a dedicated team in Jordan and the UK who provides expert advice, one-to-one consultation, weekly Zoom meetings to the natal unit at Al-Aqsa Hospital to speak to mothers and midwives, and nurses looking after patients. Establishing breastfeeding as the main modality. We have a WhatsApp group in Arabic for mothers in Gaza that they could join and ask the questions and receive regular messages of support. And we have another subgroup working on mental health support and how do you provide perinatal mental health support for mental health diseases, so psychosis, bipolar, and postpartum depression, as well as the well-being of the mothers and the staff in Gaza. The staff in Gaza, burnt out is an underestimate of what they are going through. And we have a group that looks at palliative care in the context of neonatal period and how kangaroo care and breastfeeding plays a role in providing this palliative care for infants in the absence of everything else. And we call it the circle of love, with a mother and infant at the centre and all those people around them. Doesn't matter what background they come from, they're coming to share this aim of supporting the mother and the baby at the centre. And we do whatever it needs. Science is the basis of what we do. We don't want to do anything without making sure it actually complies with the principles of helping. We don't want to cause harm unknowingly. At the same time, we're pragmatic about it, we're very creative, and we do it with the people. And we're learning a lot. Gaza is teaching us a lot. Everyone taking part in this project is benefiting immensely. And I don't know if you came across a book called the Palestinian Laboratory that talks about Israel utilising the Palestinians as a lab test for all their weapons. Our experience is Gaza is a humanitarian laboratory, telling us how to do things. One of our members is actually a nutritional advisor on the emergency breastfeeding committee in Scotland, and she thinks that there is a lot of what we have done that could be transferred to the Scottish context. If we have a flood or any natural disaster, what we've done in Gaza could be extremely useful to Scotland, and this is a mutual relationship that we are offering, that we are learning with the Gazan friends and from the Gazan friends, so that the mothers and the babies at the centre, wherever they are, would benefit from this. And this helps me to heal as a Palestinian, and helps me to cope with my day-to-day work in the NHS. And this is an Instagram account, which when we've got the time, we try and update it so that the people could know about the good work that the Gazan members of the team are doing. So thank you very much for your time.